somebody who is trained to fit and measure individuals with corrective lenses, so glasses, things like that. So when you go into an optical shop, you pick out your frame, they're going to tell you, oh, based on your prescription, maybe this type of lens is going to fit best for you. Or they're going to measure where the glasses need to sit on your face, how to properly adjust them, things like that. Myself, I'm an optometrist, so I'm a primary eye doctor. So what that means is that primary eye care, I'm going to correct your vision. I'm going to look at the overall health of your eyes. I'm going to see that, oh, if there are any certain specific conditions that need further investigation, that I can do the testing for you or relay you to a specialist, which will be an ophthalmologist. An ophthalmologist is somebody who's gone to medical school, but after the medical training, usually spend a few years afterward in residency and fellowship to specialize in surgical procedures. So most people think cataract surgeries or, lid procedures, things like that. So one of the great things about being an optometrist is that you're not just looking at a pair of eyes, you're actually examining the overall health of a person. So we have this wonderful privilege of being able to look inside your eyes and look at blood vessels and, capillaries and all those different structures that can tell us the overall health. So for somebody who has high blood pressure or diabetes, I'm able to look at, how well is that diabetes maintenance going? Are there some leaky vessels? Do we need to, notify your PCP or your endocrinologist to modify medications or anything like that to make sure that you're maintaining your blood sugar levels? We can tell that from a detailed eye examination, which is really cool. It depends on your needs. For some people looking for glasses or contact lenses or, just general eye care, they may think, oh, I'll go to optometrist. If you need some more specialty conditions, you may be referred to an ophthalmologist by an optometrist or your primary care doctor. But I always tell patients you want to go with somebody who you're comfortable with. You're going to be developing a relationship with your provider, and we often see patients over multiple years in their eye care. Sometimes we get referrals from friends, family members, or other doctors like, oh, I've spoken with Dr. So-and-so. I really like what they did. They're very thorough, and we get referrals that way too. So I usually tell patients if you're fairly healthy adult, usually every couple of years is what we kind of push. I like to get my eyes examined every year. That's just my preference. I usually tell people if you are, younger age, so children through early 20s, your eyes are still developing, you're still growing. We want to see you every year. And once patients start hitting 55, 60 and older, you are more at risk for more age-related diseases such as cataracts or macular degeneration, and we want to screen you for those. So we're going to recommend every year at that point. It's a really common condition. It's chronic, and basically what happens is that your eyes have this feeling of dryness, burning. Some people may experience pain or itching or redness, but it's caused by lots of different factors. For most people, it's age-related. However, there are some environmental factors that can contribute to dryness of eyes. So are you around a smoky, polluted environment? Is it really dry where you're working? Or for some people, even the medications that we take. So anything that can dry you up, decongestants, allergy meds, even antidepressants can have an effect on the moisture level of your eyes and how your eyes are producing tears and how comfortable they are and how dry they are. We can use artificial tears or lubricants to help treat dry eye, but some conditions require some more medical therapy. So anything ranging from topical steroids to, immune modulating drugs such as Restasis that some people heard of, or Zedra, or things like that. The range depends on how severe your dryness of eyes are. Cataract is that the lens that's in the eye becomes cloudy or opaque over time. Some people can develop cataracts early on due to medications or injury, or they could be born with it. But for the general population, most of the time it's age-related. And so sometimes people may experience glare or a change in their vision that doesn't really correct well with their glasses or contact lenses. And so that's the point where we will make a referral to an ophthalmologist and they would do a cataract removal surgery. fairly short, pretty quick. It's a very common procedure done. And what happens is that the cataract is actually removed and we put an implant in. It's very small, kind of like almost like imagine the size of an eraser head on a pencil. It's a fairly small implant, but it's able to correct your vision and get rid of that glare and really can help you improve your quality of life afterward, which is great. EyeCare Center here at Manitowoc County, the Aurora Health Center. We can also schedule appointments online as well for providers. So there's multiple ways to get a hold of us. Sure. So it starts early on. I tell people sun protection is key in terms of reducing your risk of macular degeneration or cataract development. So when you're outside, sunglasses, hat with a brim. Another thing that really affects ocular health as well is tobacco smoking. So I tell people no smoking or try to get into a smoking cessation program. That really can affect your risk factors for not only cataracts and macular degeneration, but also dryness of eyes as well and other conditions. And then overall, just maintaining healthy diet and getting routine screenings can really help you out in the long run as well.